Hello everyone, this is Dr. Aditya Sibichakravarti, interventional cardiologist, and today we'll be discussing about NSTEMI. So, what is NSTEMI? NSTEMI is a type of heart attack. It is the most common type of heart attack. In fact, 70% of all the heart attacks we have is because of this NSTEMI. So, but it is quite different from the serious forms of heart attacks like a STEMI in the fact that it won't be that dramatic in presentation. They won't have that much significant presentation. So, what is this in STEMI? The term N means non and STEMI means ST elevation MI. So, it literally means you have a heart attack and that heart attack is not showing ECG changes, not much ECG changes. That is what we try to call it as NSTEMI. So, what is a heart attack? So, heart attack literally means you have your heart, and the heart in its covering you have three blood vessels, one on the right side and two on the left side. And these three blood vessels will supply your entire heart muscles. If there is a block in one of the three arteries, you will have a decreased blood flow. When the blood flow to your heart is decreased, you have all the symptoms of pain, breathing difficulty, and all the symptoms. It literally means there is a decreased blood flow to your heart. So, what is this NSTEMI and what is this STEMI? NSTEMI, you have 90% reduction in the blood supply. In NSTEMI or in STEMI, you have a 100% block. In NSTEMI, you have a 90% block. So, it is occluded. You still have pain, but it is not completely occluded. That is what is called as NSTEMI. So, okay. So, what are the symptoms of this NSTEMI? It will not be as dramatic as all the heart attack. You will have chest pain, definitely, and that chest pain will increase when you start to work, when you start to climb stairs, when you do some physical activity, the pain will start increasing. And then you will have sweating. Your body will be profusely, you will have sweating, and you have that pain that is radiating to the left arm, to the right arm, to the jaws. It will keep the pain can be radiating. And sometimes you won't have any chest pain, you will have other symptoms like, as I said earlier, you will feel very much tired, feeling very much fatigued, and feeling some breathing difficulty or some sort of uncomfortable sensation over the chest, especially in females. Who are like 15, who are like 40 to 50. A lot of females will have these atypical symptoms, so that can also be a symptom. So, who are the patients who are at high risk of developing this heart attack? As I said earlier, any patient who is a diabetic, who is having blood sugars very high, and any patient who is hypertensive, who is having high blood pressure, any patient who has got a high cholesterol levels, and obviously any patient who continues to smoke or any patient who continues to have alcohol, all of them are at high risk of developing this heart attack. And what is the other risk factors? The most important one is your family history. So what do I mean by family history? If any one of your parents, whether your father or your mother, had some heart problem, say around 40 years or 30 years, then you are at a high risk of developing the same problem because you inherit the same genes. So you are also at high risk. So if you are someone who is having sugar or a BP or a cholesterol or a positive family history, you need to take steps to protect your heart. I will tell you what to do. So then, how do you diagnose? Then how do we identify this patient? Any patient coming with chest pain, as I said earlier, the ECG will not be showing dramatic changes. That is why it is called as non-STEMI. It will still show some changes, but then we'll do an important blood investigation. The blood investigation is what is we call as cardiac biomarkers. And what is this cardiac biomarkers? If your, as I said earlier, the blood vessel to your heart is blocked, and that will release few enzymes into the bloodstream, and that blood in enzymes we measure it and we diagnose that you are having heart attack. And examples of that is called as troponin, a highly sensitive troponin T and highly sensitive, and then a CKMB. These two are the blood tests which we do. And then obviously will do an echocardiogram. By doing the echocardiogram, we will identify whether there is any movement abnormality of a heart. We will find it. So once you are diagnosed with having an heart attack, and what next from there? So in the hospital, we will give you injections, probably something called as anticoagulations, because there is a blood clot, and that clot needs to be dissolved. For which we will give you some injections for 5 days, and then we will put you on few medication, blood thinner medications. So they will prevent your in your blood there is some blood cells called as platelets, And these platelets basically they stick together and they block the blood vessel. And we will try to give few medications that will try to unblock these platelets and so that the blood supply is maintained. So that medications we will give, and we will give you medications for cholesterol to control the cholesterol, and then for medication to control your blood pressure, to sugars. Those things we will do it. Sometimes, if it is required, we will do an angiogram. Angiogram means we'll put one injection in your arm, we'll put one guide into your heart blood vessel, and we'll give an injection. And then we will see how much block is there. If it is very significant blockage, then the doctor or cardiologist will go ahead and do a balloon dilatation, and if required, a stenting to prevent its further closure. So that can be done. And if it is very severe, you may also require a cardiac surgery, a bypass surgery. So once that is done, what you should do, that is the most important part of the video. What kind of lifestyle you can change and to prevent such attacks in the future. The first thing you can do if you are having this issue and if you are diagnosed with this issue is that you will have to quit smoking. See, the most important risk factor for any cardiac issue is smoking. If you continue to smoke, there is a high chance you may have a second heart attack and you may not survive that. If you are any of your family members or any relatives is continues to smoking despite having all these risk factors, kindly inform them it is a high risk thing. They should stop it immediately. This is the first thing. And second thing, after smoking, you should have a healthy lifestyle. By healthy lifestyle means you should eat a heart healthy diet. What do I mean by heart healthy diet? You should eat more of fruits, lot of vegetables, lots of nuts, and lots of grains, whole grains, not the polished ones. So we try to eat this more natural and try to cut down on all the fast foods, all the foods that are rich in calories, all the fried foods. Those things you try to avoid. And if especially snacks, which you consume a lot of snacks, those things you try to cut down and replace them with healthy snacks, with fruits, with vegetables, with fruit juices, and those things you can take in more quantity. And the other thing you will have to do is more important is that you should start walking. You should walk at least 30 minutes a day, and you at least in a week you should walk at least 150 minutes. Only if you walk 150 minutes a day on a week, you will have a very good physical activity, and that will prevent further heart blockages. And the fourth thing you should do is that you should come out of the stress. Mental well-being is very important, and it is least importance is given to that. Even we cardiologists don't make sure that you don't sleep. You have to sleep adequate time, at least 7 hours a day is a must. And then you should have some good physical activity every day, and you should do something that you love. Playing with your children, or going out for a walk, or doing something that is relaxing, or doing some meditation, doing some yoga, and reading some books, and journaling. That is something I do when I get a lot of stress. I try to write things out, and that is like putting things outside, and that is actually helping me also. You can do that also, but find a way to keep the stress out of your mind. That is important. And what else you can do is that you should adhere to the medications. A lot of times we see a patient who has come with a heart attack, is put on a stent, and then he is given some medication, and the patients used to skip those medications, assuming that they don't have any pain or no symptoms at that present. So the thing which I'm trying to say is that you should always take your medication, and you should always get your checkups with your cardiologist very frequently. So to prevent the next attack, you should make a good lifestyle changes, which is actually good for you in general and also for your heart.